Shocking. 1 minute ago, 40,000 paramedics walk out, 61 emergency zones in total chaos. Stop everything. This just happened, and Britain is facing an unprecedented emergency. Tens of thousands of paramedics have walked off the job, leaving 61 zones without critical medical support. Hospitals are overwhelmed, emergency calls are delayed, and ordinary citizens are caught in a terrifying reality. What you're about to see exposes the fragility of Britain's healthcare system and why this strike could have deadly consequences if it continues. The first signs appeared early this morning when emergency hotlines began reporting unusually high wait times. Calls that normally would have been dispatched within minutes were delayed by hours. Patients requiring urgent attention found themselves caught in a gridlock of bureaucracy and system overload as the absence of paramedics became painfully apparent. Social media quickly lit up with videos showing ambulances stationary outside hospitals, staff waving to try and coordinate, and queues of worried citizens unsure of what to do next. Paramedics have long warned of staffing shortages, rising workloads, and unsafe working conditions. Over the past months, reports of burnout, mental health struggles, and exhaustion have multiplied. These professionals are at the front line of life and death situations daily, yet many argue their pleas for support have been ignored. This strike is not simply a labor dispute, it is a flashpoint highlighting systemic failures in emergency health services. Official statements confirm that negotiations between paramedic unions and health authorities broke down last night, despite weeks of mediation. Key demands reportedly include higher pay, better working hours, increased staffing levels, and protections against unsafe workloads. The unions argue that the current system is unsustainable and that without urgent reforms, patient care will continue to suffer. Officials, on the other hand, express concern over the sudden timing of the strike, which comes without prior warning in some regions. The public response has been a mix of shock, anger, and support. Families awaiting emergency assistance are understandably frustrated and frightened. Some have taken to social media to voice their concerns, posting messages about delayed ambulances and extended waiting times in critical situations. At the same time, many sympathize with paramedics, recognizing the immense pressure they face and the sacrifices they make on a daily basis. The situation highlights a tense balance between public safety and labor rights, with emotions running high on both sides. In major cities, hospitals are reportedly struggling to cope. Emergency departments have been inundated with patients arriving by private transport, neighbors, or volunteer assistance, filling the gaps left by the absent paramedics. Staff are working overtime, often beyond capacity, while authorities scramble to reroute emergency calls and coordinate backup measures. Some local governments are even considering mobilizing military or auxiliary medical personnel to fill critical gaps temporarily, though experts warn that this is only a stopgap solution. Analysts are warning that the strike could have ripple effects far beyond immediate emergency response. Delayed medical care in critical cases can lead to worsened outcomes, increased hospitalizations, and tragically, preventable deaths. The public health system, already under pressure from rising patient numbers and ongoing challenges, faces a compounding crisis. Economists and health policy experts alike note that the cost of inaction or prolonged disruption could run into billions, factoring in both economic and human costs. The scale of the strike is unprecedented in recent history. 40,000 paramedics represents a substantial portion of the nation's emergency workforce. The fact that 61 zones, covering major cities, suburban areas, and rural communities, are affected simultaneously underscores the depth of the discontent and the organizational coordination of the unions. This is not a spontaneous protest. It is a coordinated statement designed to force urgent attention to structural issues within the health system. Government officials are responding cautiously but urgently. Crisis management teams have been activated, emergency hotlines are being supplemented with temporary staff, and rapid coordination between hospitals, police, and local authorities is underway. Still, officials acknowledge that the situation is fluid and that managing public expectations is one of the biggest challenges. Citizens are being advised to only call for emergency services in true life or death situations, while non-critical patients are being redirected to alternate care centers or telemedicine services. The strike also raises serious questions about long-term planning and investment in health services. Experts warn that if systemic issues such as staffing shortages, burnout, and insufficient funding are not addressed, similar large-scale disruptions could occur again. The current strike may be a warning shot, signaling that without meaningful reform, the emergency response infrastructure may become increasingly fragile. Political reactions are already emerging. Opposition parties are criticizing the government for failing to anticipate or prevent this crisis, arguing that years of underinvestment have made such a strike inevitable. Supporters of the government acknowledge the challenges, but emphasize ongoing efforts to improve healthcare funding and working conditions. Meanwhile, union leaders stress that the strike is a last resort and that negotiations could resume if their demands are seriously considered. Public sentiment is sharply divided. On one hand, many are sympathetic to paramedics, recognizing the impossible pressures they face day after day. On the other, the public is anxious, frustrated, and scared. Delays in ambulance response affect the most vulnerable, the elderly, those with chronic illnesses, and anyone experiencing a medical emergency. For these citizens, the strike is not abstract. It is immediate, tangible, and frightening. Social media has become a key battleground in shaping the narrative. Videos and images of ambulances idling, emergency departments crowded, and paramedics picketing outside hospitals are spreading rapidly. Citizens are sharing personal experiences, highlighting the human impact and demanding action. Meanwhile, misinformation is also circulating, prompting officials to issue repeated statements urging calm and fact-based reporting. Experts emphasize that communication is critical during a crisis like this. Authorities need to convey accurate information, manage expectations, and provide clear guidance on what citizens should do if they require urgent care. At the same time, the unions are using media channels to explain the rationale behind the strike, detailing the risks paramedics face daily and the urgent need for systemic reform. The interplay between public messaging, media coverage, and social sentiment will significantly influence how this crisis unfolds in the coming hours and days. International observers are watching closely. Countries with similar emergency response systems are taking note of the UK's experience, recognizing the potential vulnerability of underfunded or overstretched healthcare infrastructures. Lessons learned here could influence policies elsewhere, making this strike not only a domestic crisis, but a case study in emergency workforce management globally. As the hours progress, the full impact of the strike will become clearer. Hospitals and emergency centers are preparing for prolonged disruption. Community organizations and volunteer networks are mobilizing to support vulnerable populations. Meanwhile, paramedics remain steadfast, emphasizing that their actions are intended to protect both their own safety and the quality of care patients ultimately receive. This strike is about more than wages or working hours. It is about systemic sustainability. Paramedics are at the forefront of life-saving services, and their absence reveals how critical they are to public safety. The unfolding events highlight vulnerabilities in planning, staffing, and resource allocation that authorities cannot ignore. For ordinary citizens, the situation is immediate and personal. Families waiting for urgent help, patients with chronic conditions, and those living in remote areas face uncertainty like never before. The reality of a nationwide strike of this magnitude is stark. Emergency care, a service most take for granted, is suddenly limited. It underscores how much modern society depends on frontline healthcare professionals and how fragile systems can be under pressure. Law enforcement is also involved, coordinating with medical authorities to ensure public safety, prevent opportunistic crime, and maintain order around hospitals and clinics. Security around medical facilities is being increased, while contingency plans for high-risk situations are being implemented. Officials stress that these measures are temporary but necessary as the strike continues to unfold. Analysts are already warning of potential cascading effects. Delays in emergency response can impact hospital workflows, critical surgeries, and ambulance availability. Even short disruptions in coverage can have serious repercussions, and if the strike persists, secondary impacts, such as increased emergency room congestion and longer waiting times for routine care, are likely. Union leaders have reiterated that the strike is a call for urgent reform, not an attack on public safety. Their message is clear. Without immediate action to address staffing shortages, unsafe workloads, and insufficient support, healthcare services will continue to face catastrophic strain. They argue that the public will benefit in the long term if the system is strengthened now, even if the short-term impact is painful. As night falls, the situation remains volatile. Hospitals continue operating under extreme pressure, emergency calls are being triaged, and citizens remain on edge. Media coverage, social media updates, and official statements are keeping the nation informed, but the uncertainty persists. What is certain is that this strike is historic in both scale and impact. 40,000 paramedics walking out across 61 zones is unprecedented. The consequences will be studied for years to come. Policymakers, healthcare administrators, and the public alike are being forced to confront uncomfortable truths about the fragility of emergency systems, the pressures faced by frontline workers, and the importance of proactive investment and planning. In the coming hours and days, negotiations may resume, temporary measures may stabilize emergency response, and the immediate chaos may subside. But the lessons of today will remain. This strike is not just a story of protest. It is a wake-up call for the country, a reminder of how critical paramedics are, and a stark example of what happens when systemic issues go unaddressed for too long. Britain is now in a moment of reflection, crisis management, and urgent problem-solving. Citizens, policymakers, and healthcare professionals alike will remember this day for years to come as the moment 40,000 paramedics collectively demonstrated the importance of their role and the need for urgent systemic change. The impact is already historic, and the story is still unfolding.